I shared something on TikTok and it went viral, especially for me as somebody who has less than 1,000 followers on TikTok. My post has now 64,000 views, and most of that came in the week or two after posting. What did I say that was so intriguing to so many people? I'll share that with you today. But first, who am I? My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I practice through my telehealth clinic, Missouri Metabolic Health, where I help patients achieve and maintain sustainable lifestyle changes to improve their health outcomes, both from a metabolic standpoint and from a weight standpoint. What I said was that obesity is a chronic medical condition that requires chronic treatment. Now, depending on your exposure to the field of obesity medicine, this may seem like dramatic, out there, crazy, or it may seem obvious. As a physician who sees patients with the disease of obesity every day, this to me was an obvious statement. But to many people, it was not, and it was offensive or seen as untrue. The American Medical Association first recognized obesity as a chronic medical disease in 2013. And so it has not been that long that even our main medical association has identified obesity as a disease. So I understand why the general public may have some misunderstanding of this condition. The World Health Organization defines obesity as abnormal or excessive fat accumulation that presents a risk to health. And I'm going to also share the Obesity Medicine Association definition of obesity. This one is a little bit more complex, so I'm going to read it directly. It is that obesity is a chronic, relapsing, multifactorial neurobehavioral disease wherein increase in body fat promotes adipose tissue dysfunction and abnormal fat mass physical forces, resulting in adverse metabolic, biomechanical, and psychosocial health consequences. I like both of these definitions. I tend to favor simplicity, and so I do like the World Health Organization definition for that reason. But I also really like the Obesity Medical Association definition because it touches on the complexity of obesity and weight management. I want to stop and really emphasize one important fact, and that is, even though I say, and these medical associations say, that obesity is a disease, in no way are we saying that somebody who has obesity or has an elevated body mass index or higher body weight or is carrying excess weight, in no way are they a diseased person, are seen as lesser. We are trying to emphasize the opposite. We are trying to highlight what is happening inside their body. This has nothing to do with somebody's self-worth. We all, no matter what our body size, shape, age, gender, color of our skin, how we look in any way or fashion, we are all 100% worthy. And I want to really emphasize this. By identifying obesity as a disease, we are able to study it, address those changes that we know are occurring, and then learn how to appropriately, effectively, safely correct that to improve health outcomes. The reason that obesity is a disease from a medical standpoint is that once somebody has excess weight, there are real proven biologic changes that happen in their body that affect their health and affect their metabolism and the way that they are able to maintain their weight, or if they're able to lose weight or not. Like anything in our body system, we want to maintain what we call homeostasis, which is a consistent state to keep ourselves healthy and functioning optimally. And our weight is the exact same. And so once we have gained weight over time, our body wants to protect us. And this is where we see those physiologic, biologic changes occur to protect us from weight loss. And this occurred over thousands of years of us being humans, and previously food, calories, energy, it was hard to come by. And so the people who were able to store the extra calories, the extra energy as fat were the ones who survived and thrived, and those are our ancestors. We now live in a modern society where food for most of us is easier to come by, but our biology, our genetics have not caught up with that. And so, in an attempt, again, to protect us, when we are trying to diet and lose weight, our metabolism decreases. Our hunger hormones go up. This is why obesity is considered a disease state, because it is a deviation from what is considered normal biology, physiology, human function. And it leads to poor health outcomes. Not 100%, not all the time, and not in everybody, but it increases your risk. And so to protect the majority of our population, because we know that 40% of Americans, at least American adults, are in the obese category. So 40% of our population is at higher risk for diabetes, heart disease, high blood pressure, stroke, blood clots, osteoarthritis, sleep apnea, certain types of cancers, and many more conditions. I think what has a lot of people confused is that there is a difference between the prevention and the treatment of a condition. The same thing with obesity. There are things that people in the health and wellness community are doing that are preventing the development of obesity. And they believe that if people who had excess weight, who had obesity, did those things, then they would not have obesity. And that's not the case, because we know those biologic, pathologic changes have occurred. We see this with all other diseases and conditions. A great example is lung cancer. We know that smoking is a risk factor for lung cancer. Does everybody who smokes develop lung cancer? No. Are there people who did not smoke that developed lung cancer? Yes. And the treatment of lung cancer is not to stop smoking. While that is extremely helpful, that won't cure the cancer. We need to either have surgery, radiation, chemotherapy, immunologic therapy, or other treatments. Same is true with the disease of obesity. Healthy nutrition, exercise, sleep, stress management, all of those things are going to help once somebody has obesity. It's going to help prevent the development of obesity, but for most people, it is not going to treat and manage their obesity. We need other options. And that is where medications and surgery come in. What's wonderful in the time that we live right now, and what is going to continue to be available, are several options for treatment. And working with your doctor, especially somebody board certified in obesity medicine, is going to make sure that you have the best, most optimal, individualized treatment plan for you that really focuses on health-related outcomes. In that post that went viral, I compared obesity to blood pressure, high blood pressure. And if we give somebody who has high blood pressure a medication and we get their blood pressure under control, that's great. The blood pressure medication is working. We continue it. If we stop the blood pressure medication, then their blood pressure goes back up. Anybody who has worked in medicine or has had high blood pressure knows this to be true. It's the exact same for obesity treatments. If we decide to start a medication to manage obesity, we are going, or very likely we are going to need to continue that long term. And just like everything, that's individualized, and maybe somebody who did not carry excess weight for a long time, maybe they don't need long-term treatment. But for those people who have struggled with obesity for the majority of their life, it is highly, highly likely that they will need treatment indefinitely, at least from what we know now. Of course, there are things that change all the time. So I will continue to spread this message along with my colleagues in obesity medicine that obesity is a disease. That does not mean that people who have obesity are a diseased person or should be treated as less than. They are 100% worthy. We are all 100% worthy, and we are all worthy of effective and safe treatments for whatever condition we have. And that treatment should be continued long term to maintain that effectiveness. We see parallels in other chronic conditions, and obesity really should be treated the same. Please let me know if you agree. If you have questions, comment below. You can also visit MissouriMetabolicHealth.com. Send me a message directly there. I also encourage a continued conversation on Instagram or TikTok. You can find me at Dr. Lindsay Ogle. All of the links are below. And I hope to see you next week. So hit this like and subscribe button, and we will continue this conversation.